people we serve are have really complex mental health, substance abuse, and healthcare situations. Many of the people we serve have limited resources and are homeless, and so the telehealth opportunities greatly improve access for people. I wrote some notes to tell you a little bit about it. Okay, so we recognize that the face-to-face, the telehealth doesn't replace the face-to-face opportunities we hope to continue to be able to do, but in some cases it's been life-saving to be able to connect with people that way. One of the things we've done, for example, is we have a number of people who have been homeless down in the encampments or in the shelters. We have set up a telehealth service in the Little Sisters of the Poor shelter so that some of those people could come in and be able to access the services right away to get medication. And that's just been vitally important. We also need to continue to do electronic communication with people, phone or the telehealth, because it also helps to be able to serve people regardless of their location and the ability to access transportation. That's also been a difficulty. Buses stopped, a lot of that was limited, so it's really critical for that. Again, the telehealth improves access for people with physical and emotional limitations. We have actually found we have improved show rates. We have been able to see more people. Megan will be talking to you a little bit about our outpatient services. But people who have normally not been able to, we've been actually able to really make some connections with. So that's been really important as well. There's two critical areas I want to tell you about, though, that we have been able to not only continue to serve, but able to move forward with. And one is our connection to the justice services. So we've been able to use telehealth and actually improve our access for them by being able to go into the courts and the jails with electronic services to be able to let those folks access our care. We've really been stepping up our services in that way in the county and the city, so we've had both of them. The other area is the hospital, people in the hospital and emergency rooms. What happens is that if they make a referral, they give them a card, they leave, they often don't call or follow up, same way with the courts. But us being able to have an electronic presence immediately really has reduced the fall off rate. And so people have been able to connect with us in a lot more timely way. That saves all of us a lot of time and money if we can really connect with people and get them engaged quickly. So I just really want to say that I think, I know that this has been something that you've been moving forward. I think that electronic care greatly improves our efficiency and our effectiveness. Again, it doesn't replace our desire as we move past COVID to be face-to-face, but it's been extremely important to be able to do the work we do. Megan and Joris will be discussing some other services we provide in-house. I think that I definitely want to reiterate that because of the low income of folks, Tony talked a lot about it, the broadband and the telephone opportunities are still something we have to continue to grow so that all folks can have access. Thanks again. Thank you.
Thank you. Well, let me just say this. Both of those are priority to me when you talk about broadband and how do you deliver that service. The other thing I want to tell you thanks for doing is going to those jails and people are incarcerated. And that's coming from an old sheriff that used to run a jail. But for years, you really had deputies or you had personnel that had no experience whatsoever in mental health. And we're trying to deal with those situations. So anytime you're expanding that, I think that's a good thing. And I think society as a whole gains from that.
Yeah, we formed some really good partnerships, and I'm really excited about it.
Good for you. Good
Thank
for you.
you.
Thanks for doing that.